is, well, we sort of dealt with this a little bit when we talked about the methotrexate, but I think this is another issue that came up. Maybe Dr. Targownik, you can answer, and then we'll open it up to the rest of the panelists to see their opinion. But would you either change the timing of your biologic to suit when you might get the vaccine, or is there a specific time within the cycle of biologics, within injections, that you would try to time the vaccine in there?
That's a great question, and it's one that I think there's really a lot of speculation about, but probably not yet a lot of knowledge. So, one of the things that when people ask questions like this, that I always want to stress is about the safety of these medications, and this applies right across the board with biologics. That as a group of medications across the classes, they are very safe medications, and we don't have a lot of evidence that the timing, that the levels of the drug in your system at any given point. Of course, you're going to have a lot more drug in your system after you get an injection, maybe a lot less before your next, or a bit less before your next injection. We don't have a lot of evidence in general that level, whether it's high, low, or in between, correlates or is tied to the risk of a complication or an infection. So my inclination is that if you are offered the vaccine and they assign you a date, and given how things are going right now, you might not have a lot of flexibility around getting a vaccine. So if they tell you to come on this day, it might be we'll come on this day, or who knows how long you'll be waiting, is you should go. And it doesn't matter if you just got your infusion or your injection, and it shouldn't matter if you are just about to get your infusion or your injection. Go and get your vaccine. The likelihood, in my mind, of having a complication from getting the vaccine, the vaccine timed at a suboptimal time is probably much less than your risk of acquiring COVID if you have to wait. There's also the risk of, if you get off cycle and start missing doses and having to get rescheduled in, potentially flaring. So if I were writing the guidelines myself, I would say to just get your vaccine whenever they offer it, and don't worry about where you are in your cycle. Now, having said that, I'm aware that the rheumatologist has put out some guidelines that I found to be fairly complex, that suggested that, depending on which medication you are, and you're supposed to wait this number of days or that number of days. When you actually look at the evidence supporting it, it's all speculative. So I recognize different people with the same information can come to different conclusions, but my recommendation would be, if you're offered the vaccine, get the vaccine.
Yeah, and I totally agree with you, Laura. And one thing I just wanted to make a note of is the major side effects that people experience with the vaccines, as Eric described in his presentation, is essentially local reaction. And really, it's your body developing an immune response to COVID. So the ill feelings that you're experiencing is those antibodies revving up to actually fight COVID down the road in the future. And often what people experience is that it's relatively mild on the first shot, and they can potentially be more significant on the second shot. So the only other advice that I'm giving my patients from a practical perspective is, if they do have a little bit of flexibility, you may want to time that dose of vaccine a little bit away from your infusion or your injection, mainly because if you do feel unwell, sometimes it's hard to differentiate, well, was it the vaccine or is it infusion or injection like that. So if you have a little bit of flexibility with dates and times, you sometimes could just space it out a little bit, just to kind of separate that feeling of being unwell that is likely to happen as a response to particularly the second shot of the vaccine.